All right. Aloha. Uh, May the 4th be with you. It is May the 4th, and again, I am Dr. Albert Lin, the traveling doctor, coming to you. Little tired. I have just finished I basically finished a 2-week kind of course work, so it's a little tiresome. Had about 9-day shift, and I am off finally 2 days or 2 nights and 7 days. So hope everyone's doing okay out there. I've realized as things go along, there's a little less new news to report, and unfortunately, a lot more just sort of debunking theories and putting to rest some conspiracies. This is sort of a problem for me because I think COVID-19 has been in the news long enough. Unless you're under a rock, everyone has heard pretty much everything they can about everything. And as one of my friends mentioned, everyone's getting all the same information. They're getting all the same sort of words, they're getting all the same sort of theories and all the same research. It's just, I don't think anyone bothers to actually look at what the research is saying. They're kind of just taking it for face value and forwarding on, I don't even want to go into all the theories and conspiracy theories. I'll address a couple of them though. First, I sort of want to go and talk a little bit more, and I know I've talked about this all the time, about antibody tests. And the reason I want to bring it up is I am actually going to be getting my antibody test tomorrow. So I am actually going to be scheduled, and my PCP doctor, he was actually nice enough to schedule me for it. Hawaii only started doing them Thursday of last week, so it's been less than 4 days since we have been able to get them in Hawaii legitimately. The first hospital to do them is actually called, it's the Hawaii Pacific Health Group. They run a couple hospitals here, Palimomi Medical Center, Straub Medical Center, Kapiolani Women and Children's. So they're testing all their employees for free, which is really nice because they're not even the biggest hospital system, and they're not Kaiser, but they're testing all their employees for free. So I get one of these tests tomorrow, which is a really big deal for me because, as you know, I tested my PCR test, and I did that a little while ago, about a month ago, and I was negative, even though I thought there was a decent chance I could be positive. I wasn't super sick, but I was, as you remember, very sick with pneumonia in February, very, very sick, the entire month. I even traveled with it to Australia. I had 3 rounds of antibiotics, a really bad cough, and I don't know, I was even short of breath. I don't know how bad my oxygen level was. But anyway, I was negative PCR test, but I will get this antibody test tomorrow. An antibody test, I should have the results back within a day. So what does that mean? I think what that means is it's going to be, it'll give me a little bit of information. What does it mean is that I will get, as a review, I'll get a test that will say either I have IgM, which is initial infection antibody, or I have IgG. And IgG is sort of what they call the immunity antibody. And that will tell me about supposedly COVID-19. Now, a lot of the criticism about these antibody tests is that sometimes they react against coronavirus, the normal coronavirus. So even if I get it, there is a small percentage chance that I could have that exposure to a normal coronavirus and not have had COVID-19. But I think this information is going to be very important to me because 2 reasons. Number one, I'm taking care of patients. Number two, I may want to do other things like travel someday, for even to travel to help out with medicine in New York, for example, and be able to show that I'm immune would probably be a big part for letting me travel more. And I'm going to go into that when I talk about sort of reopening and what Hawaii is doing, what other states are doing. But going back to antibody tests, so I think everyone's going to be really, really hitting this and wanting it and wondering, where to get it. And people in even California have been having access to this for a little while. So, but again, there's always the question about whether it was this antibody test is really precise. So the major one that we're getting here in Hawaii is through Abbott Labs, as I understand it, and then it gets processed through other different labs. But the main sort of kit and the reagent is through Abbott Laboratories. And so I think it's a pretty good test, 98.5%, I think, sensitivity and specificity. So should be pretty good, all things considered. And LV's joining me. LV says, what about giving plasma? So yeah, LV, I think plasma, they usually have some specific rules about giving plasma for treatment. And again, a lot of my friends, I only really have two, friends who are positive from COVID-19, they are usually told they have to be symptom-free. And that's COVID-19 positive by the nasal test, that they have to be, I think, 14 days symptom-free before they can donate this plasma. And I think it may be a different rule for the antibody test, because actually they don't want you to get the antibody test if you have any sort of symptoms like fever, shortness of breath, these other things. They don't actually want you to get the antibody test. The antibody test will be done after. The later you get it, the better it is, because there's a chance that if you're infected early on, you won't have any antibodies. So plasma, most of my friends who get sick are being told you have to be symptom-free 2 weeks, 14 days before they will allow you to donate this plasma. And the data, I have to look at more of the research. But as I understand it, the older research, when they were giving plasma to people, was very, very encouraging. I don't know the exact numbers of mortality and everything else. I think very so, I think that is one of the things to think about with plasma, is that if we get sick, and a lot of us will get sick, and I think one other thing is that's what's good for the antibody test. You may never know you had it, but as healthcare workers start to get these antibody tests, and as normal people start to get the antibody tests, in the beginning, it's always the same thing. It's always hard to get these tests. It's like it's hard to get toilet paper and everything, and they prioritize it to, again, healthcare workers, first responders. But at a certain point, the antibody test will be available and will be better, and everyone will get it. So what can happen is, even if you don't have any symptoms, say you have your antibody test, and it shows that you are positive for antibodies. If you had gotten a normal swab test, that would have been negative. But the antibody test shows that you are positive. So that means that you can probably donate plasma right away. If plasma is seen to be a good therapeutic kind of a treatment, in some ways, I think, a plasma is probably going to be shown to be even more helpful, possibly, than all these other drugs you're talking about, remdesivir, Kevzara. Again, plasma is used interchangeably as IVIG. A lot of people say IVIG. That's sort of the medical terminology for intravenous IVIG, and that's the antibody. And again, they get it from that plasma. So the reason why plasma will be good is that, as you can imagine, you can get a lot of it if you have a lot of people who have antibodies and have recovered from COVID-19. And anyone can donate the plasma, and then it can be used to possibly treat a lot of people who are sick. Now, the problem, I will say, with plasma and IVIG, the one other or bigger downside is similar to remdesivir. It has to be given IV. So you can't, again, buy it and go shopping for it at Long's or Times Pharmacy or Walgreens and just pick it up and give it to yourself and treat yourself. It would never really be given for someone with mild disease. it would still probably be safe for like sicker patients in the hospital. The other problem is one person's IVIG may not be as good as another person's IVIG. That's just how it is, you know, like one person may have more antibodies or better plasma, better antibodies than another one. You don't know which one you're getting. So I think there's sort of that quality control too, you know, like when you get remdesivir, when you get hydroxychloroquine, which again is shown not to do so well, there's a set dosage, there's a set amount. And when you get plasma, you'll get a certain amount of volume of plasma and it'll be standardized, but I don't know that they'll be able to say for sure that you're gonna get X amount of antibodies, you know? So it could work, it might not work, you know, and it's really tough to say. So I don't think it becomes standard of care. Again, if you look at the news and you've been reading it and hearing all the remdesivir stuff, the only thing that's standard of care right now is remdesivir, and remdesivir is considered standard of care right now. What does that mean? That means that they can make it an official recommendation. The CDC can make that official recommendation for doctors to use it for sick patients. Before, they weren't giving that recommendation. The patients that were getting it were just getting it, you know, compassionate use for sort of clinical trials for research, or because some doctor had access to it and was able to get Gilead to donate it. And actually, that's really big news. So as the research has come out that it's quote unquote good, and again, that's only mainly the Gilead studies, remdesivir, Gilead has donated their entire supply. So if you're hoping that Gilead would make a lot of money on this, they can't. I mean, right now, they had something, I think like 140,000 patients could be treated. And I think a majority of that is going to America and Americans. But as you can imagine, all the countries around the world want remdesivir. You know, it's not just America that's sick. They're really sick people. As you hear, there are other countries that are starting to get more and more sick. And I'm jumping around a little bit, but Brazil's getting a lot sicker. As I mentioned a long time ago, I was really worried about the favelas and the slums. Russia is a really big one. Russia, for a while, their numbers were really good, or maybe they just weren't testing well and they didn't know. Now, Russia, I think it's pretty bad. I think they have something like 10,000 deaths, or maybe even 10,000 cases a day. I have to check on that, but they are not doing very well. I think Russia is going to go through a kind of a crisis. I don't think their healthcare system is set up to take a lot of this. So yeah, Russia, it looks like they have, Russia has almost 145,000. It looks like they have about, they have about 3,000. Oh no, they have about 1,000 deaths and 145,000. So they're actually doing pretty poorly as well. If you still look at those countries though that are doing the worst in terms of deaths per capita, it's still those really bad ones that you all hear about: Spain, Italy, Great Britain, France, and Netherlands all getting up there. And you know what? Right behind them still is Sweden. Has the highest number of per capita deaths, or not the, one of the highest in the world, and above the US, and only under, you know, Britain. So, you know, yeah, no problem, LV. Again, I'm realizing these late broadcasts don't get a lot of people, so I don't even know how long I'll make this one. I'll probably shorten it a little bit. The one thing I also want to talk about a little bit more was this idea of the herd immunity. I think there's still a lot of this debate, especially as we start to reopen. And as you've all seen, we have about 30 states that are reopening slowly. And those include Hawaii. A lot of those states are doing some sort of what they call soft opening. And their version of it is some sort of, everyone is still wearing masks. Everyone is still social distancing. And not everywhere is open, but some retail is open. Some states are allowing some, you know, hairdressers and even gyms and stuff. And I don't really understand this, because in my mind, there's no way to safely social distance with gyms and with yoga classes and barbershops and stylists and all that. I mean, maybe gyms you can really separate out, but you're all using shared equipment. I mean, I guess you could say if you go to Costco or shop and using shopping cart, using shared equipment too. But I really wouldn't want to go anywhere like that for the time being. Anyway, the point is that as you do this soft opening, a lot of people, as you see, there's been a lot more protests in all the different states, in Michigan and California, even here in Hawaii. And what is going on is that basically people people everywhere. Oh, I'm sorry. I just realized that I didn't hit my Instagram live. So now I'm finally live on Instagram. And again, aloha, it's Dr. Albert Lin, the traveling doctor. It is May 5th, or May 4th. I'm sorry. May the 4th be with you. And this is a weekly COVID-19 coronavirus podcast. Talking about soft openings, it goes back to this herd immunity thing. A lot of the protesters are like, we just want to welcome the Abilene coming in. Everyone says we want to open up right away, right now, and welcome the John California, John Ang on Instagram. Everyone says we want to open up California, New York, and Hawaii and everything right away. Let's get herd immunity. Let's do herd immunity. Let's open everything up. Let's just get sick. And no one is really getting that sick right now. They're saying all the numbers and all the figures and all the projections are low. The numbers are down. The numbers of cases are down. The deaths are down. Everything that everyone expected is down. So they're like, everyone's wrong. Let's just open it up, open it up, open it up. Everyone wants to open it up. And of course, if you talk to the doctors and scientists and epidemiologists, they say you got to wait because it looks good. But what we're seeing, the numbers right now, again, are a reflection of 2 weeks ago. So it may feel good right now. It may feel good to go out and walk in the park and walk by the beach. I mean, I'm surfing and I go and get takeout. I still wear my mask, but the problem is that, you know, you look at a country like Sweden and even the UK that started with herd immunity, and Sweden, their bet is their deaths per capita are really high, but they're exposing everyone right now. Their idea is that, you know, even like in New York, supposedly we have like 20% of the population or 15 to 20% of the population in New York has been exposed and have antibodies to COVID-19 already. And in Sweden, they're saying, oh no, we're at like 40 or 50 and yeah, we have a higher death rate, but then we'll get herd immunity and then our death rate will plateau off and yours won't. And you'll have to keep going because you never expose yourself. So the argument that the herd immunity and the social distancing protesters are using are, we just need to get that immunity. We need to build it up. If you saw that viral video by Dr. Erickson, who's that doctor, the urgent care doctor in Bakersfield, California, it went super viral. Johnny Fornia says he doesn't mind being exposed by hot Swedish girls. Yeah, you know, Johnny Fornia, John, maybe you won't, but I don't know if they will want to get exposed to you. Let's say you're carrying some stuff, you know? So there is an argument. I mean, no one can really argue one way against the other. In America and most of the other Western countries, and even in China, who went down hardcore, they said they don't believe in that herd immunity because the price would be too high and the pain would be too high. If you expose everyone right away, then what will you get? You don't get that control infection. You get a ton of people sick really quickly, and then you get the hospital overwhelmed and you get put on the ventilator. And then you have those things like Italy where people are dying in the hallway and they have to choose who to put on a ventilator. So we're trying to avoid those things. And now, you know, again, the hospitals aren't getting overwhelmed, so expose more and more people. Maybe you want to do like a rolling, exposure, but how can you do that? Tell like everyone whose last name begins with like A to G, you can go and hang out for like a month and then go back home. And then everyone from like H to M, you guys go hang out for a month and everyone else stay home. Like, I mean, it's kind of arbitrary how you do it, you know? So I really don't think that there is a way for society to open up for everyone and expose everyone in herd immunity and do it safely. The safest way to do herd immunity, and I've talked about this in other podcasts, is to have the vaccine. Because if you have the vaccine, even if you don't, and welcome to Isabel coming in from Sweden. Isabel's in Sweden where they're doing things very different also from the US. So there is that difference with the herd immunity versus normal infection. the sort of the dilemma, the sort of argument is that the only way you can do herd immunity well is if you vaccinate a lot of people with the vaccine first, build up a certain level that won't be sick, and then everyone else can sort of do herd immunity. There's also an argument that you could say, well, keep the most vulnerable people protected. And the vulnerable people are, again, the elderly people, the immune compromised, the comorbidities. But anything's a comorbidity: obesity, hypertension, diabetes. If you actually even look at Sweden, and Isabel, maybe you can correct me if I'm wrong, but a lot of the deaths they were seeing that were in that rate were in the elderly population, nursing homes, and other stuff. So as much as herd immunity may work for a younger generation, other places, there are sensitive populations. So it's a very difficult thing. I mean, my theory is that Sweden will actually come out of this really well, and they're trading deaths early on to flatten their death curve in a way and build up that herd immunity. And it works for them in a less populated society with less density. I really don't know that that would have worked very well in New York City, let's say. But let's say the rest of the country, a lot of the other cities are not very big. If people follow the rules and do stuff, then maybe, there's some argument that as we open up, not only do we open up retail and other things, we slowly open up to other things and people interact. I mean, people are still ideally wearing masks, even though I know there's an argument that you shouldn't even wear masks. But we will see what happens. It'll be very interesting this next month, again, to see what happens as 30 states, 32 states or more, I think even by now, more than half of America is reopening up. I mean, what I predict is going to happen, and this is just a guess, is you have to set a timer and look 2 to 3 weeks in the future. So of course things look good now. For example, in Hawaii, it is going really down. And welcome to Shirin coming in from Hawaii. So all the numbers are going down, and they are going down in Hawaii, but we haven't had those 14 days of decreasing numbers as they want to have for people in any state before they open up. Like every single state opened up in America before they had 14 decreasing days. Hawaii's really good, and welcome to Daniel coming in again on Instagram. So Hawaii is doing really well. We had a lot of decreasing days. I think we had something like 9 decreasing days, or maybe even 10. And I think yesterday or today we only had 2 cases. We're not as good as New Zealand, and welcome to Brianna coming in. We're not as good as New Zealand, and New Zealand and Australia are a model, They've completely almost closed. New Zealand has 0 deaths today, 0 deaths as a country of like 4 million people. So that's about 3.5 times the size of Hawaii. So they're not a very big country in terms of population. And they're going to make a deal. They're keeping their country closed, and they will only travel in between New Zealand and Australia. I think that's what they're setting up. And Australians will only be able to travel in between New Zealand and Australia, and they'll only allow New Zealanders to travel in between. And I think they're going to keep that for a very, very long time, very long time, and not let anyone else in. Oh, and welcome to Rainbow. Rainbow's back. Rainbow, welcome to the Facebook Live Q&A for COVID-19. So Rainbow asked, aloha, concerned what's going to happen here in Hawaii when tourists come back, if they even have money to travel. Rainbow, that's a very good segue and into what I was talking about with New Zealand and Australia. Now, New Zealand and Australia, I have a lot of friends there, and they're saying that things are going to be super, super strict. What they're going to do is that, they're not letting anyone come in at all. Now, in Hawaii, they're going to let people come in still, but Rainbow, if you read the articles, they're going to keep the 14-day quarantine up. Maybe, I would say maybe all of May, maybe all of June. They're anticipating that tourists won't really start to come up. At the best case scenario is July. So let's say they even have money. They're still going to maybe have to stay 14 days. Now, a lot of tourists won't want to come to Hawaii if they have to stay 14 days in quarantine. And no one will want to just stay in a hotel. They come here to go to the beaches and luau's, which won't even exist, but hikes and, go outside and go surfing, which I'll get to your question. So one other theory, again, as I mentioned, is I think if they have a lot of tests, rapid tests, the COVID-19 nose tests, or a quicker antibody test or something, they're going to make passengers and arrivals domestic and international, get that test or antibody test and quarantine at least 1 day, 2 days, however long it takes to come back, but it'll be less than 14 days. And if they're negative, then they can go out. So that's what I think will happen in July. I believe they're going to not let tourists in unless they do a rapid test at the airport. And my main concern is I don't know who pays for that test. Maybe they're going to have to add on a certain amount, like airplane companies, to pay for that test. And then the airport of Honolulu and Maui and whatever, charges it onto the ticket, really. Rainbow Chen also asked, what do I think of surfing and ocean swimming? Surfing MD says okay, but I'm concerned regarding water droplets. Rainbow, if you talk to a lot of my friends and listen to my own podcast, I've actually been surfing. I have been. You're right. Is there the concern that you get a spatter of spray somewhere and it gets kicked up? Because as you know, the waves kick up, but you're looking at the dispersion. Number one, I would say if you go to a really not crowded break, and by not crowded, I mean less than 20 people on a break, ideally less than 10, the fewer the better. I go to breaks right now and I see less than 10 to 15. I usually wait very late. That's my technique. I wait till like 5 o'clock, 2 hours before sunset. I sunset surf. And as the day goes along, fewer and fewer people are on the break. Your normal surfer is not going to be even 6 feet near somebody. Even in your shortest shortboard, you're going to be 8 feet away from people, if not 10 feet away. Personally, I stay 20 feet away from people because I surf an 8-foot board and I usually want twice the distance so I don't run into them. Because if you're bored, you can run into anybody. So personally, Rainbow, I don't think it's a problem to surf. I really don't. I think it's much worse to go hiking next to someone, honestly. Because hiking, they say that you're supposed to stay, really far away from people. And I guarantee you, no one who's hiking is staying 20 feet away from people. I personally think surfing is much better an activity, or snorkeling by yourself, or swimming by yourself, or, swimming or snorkeling with someone else for safety, but they're far away. So personally, even in the beginning, surfline.com, which is a surf forecast app, which I use, and again, Surfing MD, they're saying don't surf. But the recommendations have changed. So I think it's okay to surf personally. Shannon asks, welcome to Shannon. Shannon asks, how helpful are cloth masks coverings? Do they do anything at all to stop the spread of the virus, or are they there to make us feel more comfortable? So Shannon, this is interesting. And again, the CDC and the World Health Organization did not recommend face masks for a long, long time. And welcome to Birute coming in from, I think Lithuania. Geez, getting a lot of international people coming in. Shannon, so if you look back, the CDC and the organization didn't actually recommend it till the beginning of April for the public. April 3rd or April 6th. They were way behind the ball. And actually, Shannon, if you look at the porosity of normal cloth masks, first of all, you got to take your cloth face mask and shine a light through it, right? If you can shine a light through it and you can see that light, it's probably too porous, meaning it doesn't protect you. And more importantly, it doesn't protect other people from what you breathe out. The other way to test it is to test like a match or a cigarette lighter, or, one of those portable those lighters that you light a barbecue with. Light it up and put it in front of your mask and blow. If you can blow and blow out that flame, that cloth mask is probably not that great either. Shannon, what I'm trying to say to you is that those masks are meant more, a lot of people are confused about masks, whether it's cloth masks, surgical masks, or even N95, except maybe the N95, but the surgical mask, normal mask, they're not meant to keep you safe as much as they're meant to keep other people safe from you. And that's the interesting thing. That's why most people don't understand that. That's how Japanese people wear it. That's how they wear it in Europe. They don't wear it to protect themselves. They wear it to protect others. So Shannon, my answer to you is they're helpful. Cloth face masks are still helpful, at least to protect you being an asymptomatic carrier from someone else getting sick. Because you may be sick and you didn't know because you're in that 3-day to 14-day development period. The what do they call it? Why am I blanking on this world? The kind of the quarantine period where it's developing, incubation. That's what I'm looking for, the incubation period. So Shannon, I still think face masks are useful. I mean, obviously, if you have some breathing problems, you might want to pick one that's a little easier to breathe in. That's the other thing I mentioned all my other podcasts is those N95 masks that have those filters. A lot of people see those. Those are really good to breathe in for you, but again, they don't protect anyone else. They mainly help you breathe better, and they may protect you a tiny bit, but they don't really protect anyone else from what you have. So yeah, Shannon, it's an incubation period. So again, these cloth masks, I think I would still wear them. I personally will wear them. I do wear surgical masks right now, but it's just that I haven't gotten, when I go out in public to shop, let's say, or I go to Costco or whatever, but I am getting a cloth mask, a normal one, and I will wear that normally. I really only wear surgical masks, or should, in the hospital, because I treat patients. I just got done treating, I don't know, 30, 40 patients this last week. And a lot of them were people I had to worry about COVID-19, and we had to test them, and I didn't know if they were negative or not. I had to put all my stuff on, the N95, the goggles, the face shield, everything. So Rainbow says, thanks for the surf tips. Sunset is gorgeous. I'm still beginner canoes and pops, maybe not so many now. So yeah, Rainbow, you bring up a good point again about surfing. Surfing, I think, is okay, but I mean, be smart. Limit yourself to try to go to the surf breaks that are less crowded. That might mean much bigger paddle. Rainbow, I just suggest, for example, if you go all the way out to Pops, Pops is a big surf break way out from the Sheraton Waikiki. It's about a 300-yard paddle. It's long paddles, at least 15 to 20 minutes. But once you get out there, there's a lot of room and no one's near you. I go to Kaiser's near the Hilton Hawaiian Village, and it can get crowded, and a lot of more intermediate surfers go there. But if I stay on the edge and get near sunset, man, there's only like maybe 10 to 15 people. But if I go to the middle of Waikiki, I can see 40 to 50 people. The last time I went, and I don't go there again now, especially with COVID-19, 40 to 50 people on a break are a lot harder to avoid, getting crammed up than in a 10-person break, So again, I do anticipate, Shannon, kind of going more to your mask question. I do anticipate that they will be recommending masks for everyone, basically until we create herd immunity, either through vaccines or just that they found that everyone has tested positive with antibodies for a while. Everyone out there, again, I would recommend that if you're looking at getting those antibody tests, one new thing that they've seen is that the government initially created a blank kind of not check, but a blank authorization for any company to make these studies. And unfortunately, these antibody tests and antibody studies, some of them were made really poorly. In China, a lot of them were really crappy, but even the ones outside. So now they backed down and they've made it more strict, but already all these tests are out there. So if you're going to go get an antibody test and you're going to go to another clinic, try to go to the most legit clinic you go to. Try to go to a hospital-associated clinic, private urgent care clinic. But if you have to go to an urgent care clinic to get this antibody test, ask them. They should be able to tell you. Ask them what company's tests are they using. And again, go look. You can look on Google. You can look whatever and type in blank antibody test sensitivity, specificity. Look at how good that test is. Those numbers should be out there. And if it's not greater than 98.5%, or at least 98% or something like that, ideally 99% or the highest, the better, sensitivity and specificity. If it's not that high, then it's not a good test, and don't go get that test there. It won't tell you that well. Daniel asks, what are the overall stats and false negatives for PCR and IgG currently? Daniel, I can't answer that right now because I think they're using different tests. The initial early PCR tests, the initial tests they were using, and even some of the earlier ones, the ones I got, the false negative rates was 30%. In other words, 3 out of every 10 negative tests for the PCR tests were false negative. They might have been, you were actually positive, and unfortunately, maybe it was done too early and you didn't have enough virus in your nose, or maybe the test was wrong, but for whatever reason, 3 out of 10, 30% false negative. That's really bad. I think the newer tests are better than that. I hope they are. But that goes to show you that a lot of those tests are negative. And even, for example, I had a sick coworker. She got one test and she has bad fevers. Man, the day after I saw her, that scared me. But I haven't had any symptoms. I know technically I'm in the incubation period, but I haven't had any symptoms. She had one negative test and she went and got another test, and that was also negative. So that, when you have two tests that are negative, even if they have a high false negative rate or 30% false negative rate, if you get two tests that are negative in a row, chances are you are probably negative at that point. And that's a real negative, not a false negative, a true negative, okay? For IgG, Daniel, my understanding, the good antibody test, the false negative is very low, less than 1 to 2 per 100 people. So less than 1 to 2 per 100 negatives are negative. And again, when you get that IgG test, it won't just say IgG positive, IgG negative. It will tell you IgM too, IgM positive, IgM negative. And welcome to Amy coming in for Vegas, coming in. So again, IgG is really the one you want. IgM mainly shows active immunity, meaning you're sort of actively infected. And IgG shows you've gone through that infection for a while and you've built up the supposed immunity. Again, as I've mentioned, and I'm sure you've read in a million articles, there's a huge debate whether this really means you have permanent or long-lasting immunity. A lot of the clickbait headlines are trying to tell you that, no, it doesn't mean you have any immunity. You might not have any immunity at all. I don't know that that's true. My guess is that even if you don't have, let's say, lifelong immunity or even 1-year immunity, you have some sort of immunity. Because, I mean, you can think about any antibody or any cold you got before. Yes, you had a cold and, you may not have kicked it, but did you get a cold after you recovered from that cold? Did you immediately get another cold right away when you went out? I mean, some people do, but a lot of people don't. You get one bad cold, you feel crappy for a while, you recover, and then it's a couple of months or so or longer before you get another cold. So my best guess, and again, this is just a guess because they're going to have to prove it from studies, are that when you have IgG antibody positive, you will have immunity for a little bit of time, whether that's weeks and a couple months or a couple months to a year, or if we're really unlucky, it's only a couple of days to weeks, and then we could get sick again. And that's why it's still important, even if you're antibody positive, which I may be positive, that you still wear your mask, and still practice safe hand washing and everything else. I got to bring up a good point, and a lot of people don't really understand this, but there is a way, for example, if you're IgG antibody positive and IgM positive, you could test negative completely. And I don't think a lot of people understand this, by PCR. So if you stuck a swab up your nose, again, you may have no symptoms and no virus left, and it'll be completely negative, but your antibody test will be positive. What I'm saying is there's only a small window where both your PCR test would be positive and your antibody test would be positive. And you'd probably have symptoms still at that time, because that's how you would have enough virus in your nose for them to pick up on the PCR test. So again, in this next month, everyone and their mother is going to want to get the antibody test and want to get the good one. So just do your research. Go to the most legit sounding clinic you can, ideally through a major healthcare system or major hospital, and find out laboratory tests. Again, ideally, welcome to LaShawn coming in. And congratulations, LaShawn, on everything. I know you had a pretty busy last couple of months with everything. So, again, the antibody test is available in Hawaii as of Thursday. So you can ask your doctor. But again, I think they are saving it for more of the first responders and people who are really out and open. But soon, just like the normal PCR test, they're available for everyone. It won't take that long. I think it will only take like a month, maybe till early June at the latest, that they're going to have those antibody tests, and they'll ask everyone, you can go get the antibody test, So when you go get your antibody test, number one, make sure a good healthcare system that isn't just trying to make money. Ideally, if you have to go to an urgent care, that find out what antibody tests. I would suggest a legit one, a good one, like Abbott Laboratories. Abbott Laboratories is one of the, I think, 3 officially recommended or kind of approved under emergent authorization by the government that has a higher standard. So try to get the Abbott antibody test, Abbott Laboratory antibody test. That's the one I would recommend. Because otherwise you might get some crappy one from, again, not China, anyone, but it could be China, and it's going to be the wrong information, whether it's negative or positive, will be very bad for you and may not be useful, most importantly. Rainbow says, on Facebook Live says, I'm super careful and change clothes and wipe everything down when I return from grocery store. My housemates wash their hands, but don't do that. Can I hug them and then wash hands, face, and change clothes? I really miss hugs. As a teacher of cuddle parties, I'm withering without hugs. Yeah, Rainbow, that's tough. I would say, obviously, if you're living with a family and living with roommates, and obviously you have a different schedule, everyone goes out and they don't wash everything. Like, everyone probably washes their hands and hand sanitizes and wears a mask. But I still see people not wearing masks. I'm going to be honest. I go outside and, Hawaii's really good, but maybe 1 or 2 out of every 10 people are still not wearing masks. So can you hug them and then wash your hands and face and change clothes? Yeah, you can, but you may still be more at risk, because even if they, let's say they went out, you don't know what they have. I mean, the only safe way is that they wash their hands and then they go take a full shower. I would really recommend, if you want to do hugging, let everyone that gets hugged is sort of shampooed, what I do most times, and I've been a little bad about doing it, I admit, is I come home, I literally get naked, I throw my clothes, but I wear, this is a clean one, but I have dirty clothes from hospital. I throw these clothes immediately into the washer, and then I shower with shampoo and all my hair and my eyebrows and my body, and then I get out and then I'm huggable. So I think it's great if you still want to hug your housemates, your family, whatever. This is the most thorough shower, but it's better than anything. I'm just saying that when you go out and you come back, even if you were washing your hands, think about it. You could be leaning like on the grocery line, at the checkout line. You're leaning and your clothes touch something. You may be leaning on the grocery cart, that kind of thing is tough. Anne asks, when can I go visit Hawaii? Anne, I got bad news for you. They are saying the earliest they anticipate people coming in the best case scenario for Hawaii is July. So that's another 2 months. But it's May 4th, so it's 2 months away. And I need to get more details and see what the government's plan is. But what I mean by that is, I think it's going to be not until July, that you are going to have a situation where you're going to have 14-day quarantines not be needed anymore. I personally don't think that they're ever going to really get rid of these 14-day quarantines from Hawaii to Hawaii, even for residents to come back, not just mainland guests or foreign guests. I think, again, the overwhelming popular opinion is that they're going to have to do rapid testing, meaning rapid testing after you land, and then instead of quarantining 14 days, you quarantine 1 day. And if your test is negative and your whole family's tests are negative, then you can all go out. My concern would be, I don't know what happens if a family comes, and let's say you have grandmother, your husband, and a couple kids, and everyone tests negative except for grandmother. Will they let everyone else out and just leave grandma in the hotel? Like, it's complicated. I don't know how this goes. And I also don't know who pays for these tests, Personally, I would think they should just add it on, like a 9/11 fee to the ticket. And if you really want to come to Hawaii, you pay that extra amount, at least something, because the state can't test all this stuff. It's going to bankrupt the state if we give out thousands of rapid tests a day. They were flying in 30,000 people every day before. And now we're down to, I think, a couple hundred, or like 1,000 or something like that. Or I don't know, even I think it's a couple hundred every day. So we cannot pay for thousands and thousands of tests for everyone until we get a vaccine. So Rainbow says she sprays disinfectant on everything I might touch and that they have touched. And she's only hugged her roommates 2 times in 6 weeks when they're freshly washed with new clothes and haven't been outside. And she changes her clothes between common areas of the house inside a bedroom. Yeah, so, again, I think personally, dirty clothes that are outside, and I don't mean dirty, like physically dirty, it's just that, you lean on stuff. When you go outside, unless you're literally by yourself and in nature and, going straight to the beach and jumping into the ocean with, board shorts and your rash guard and then coming straight out and using your own towel and then leaving, other than that, you're probably touching something, So, and Atlanta says, okay, naked hugs are okay directly after shower. Atlanta, if you're naked after a shower and you have hugs going on, that might lead to a whole other set of issues and problems with your roommates. So I will not be responsible for that. Rainbow says also, I really want to visit Eileen, her sister, and nephews, but she's nervous for visits due to my housemates not as super safe protocols like us. Yeah, Rainbow, unfortunately, she may have some concern. It's not. This is the whole problem with visiting, right? Look, even when we open up our society or any society, I'm speaking Hawaii because I know Hawaii very well, but even if you open up any society and everyone can go out again and can go to like restaurants that are at 50% capacity, right? Or go out to the stores or whatever, who is going to risk going out to meet them? And if you do you feel comfortable now bringing that back home, to your family and other people? Again, now I really have to say, keep your eyes out for the end of May because we just started. I mean, today was like day 1, May 4th of them reopening stuff. But I think it was even over the weekend on Saturday, they were opening up some stuff. So that was what, May 2nd, right? So on May 2nd, another 14 to 21 days. So that will be May 16th to May 23rd. That week is going to be very, very key to see if our rates have continued going down. And I think Hawaii will probably be even at 0. But if they're not, and they're starting to go back up again, I think everyone has to say, that is a clear sign that opening up was too early. And we are going to be dealing with another second wave. As all of you who watch my podcasts have already heard me say month after month or week after week, my theory and my prediction is that we're not going to hit that second wave in the fall with flu season, as everyone talks about. I think that's going to be the most dangerous peak and dangerous wave because it is with the flu season and it is when things get cold. But I think our worst thing that we will worry about, our second wave is not going to wait until the fall. Our second wave will hit us by June. It will hit us by June, July latest, and then that will be potentially very demoralizing and very depressing because everyone will see that our soft opening has led to this. And Amy asked, regular soap seems sufficient. Yeah, Amy, you're right. You don't have to shampoo, do whatever for everything. I'm just saying that, if you, for example, everyone's going out and buying Lysol and all this disinfecting wipes and swipes for everything. I mean, maybe that's easier to use to clean things like handles and drawer handles and doorknobs, whatever. Yeah. But generally, even if you got like a little bit of soap and water and just wipe down your countertops, wipe down your handles, wipe down your doorknobs with soap and water, that should be sufficient. And the reason is that the virus shell, COVID-19, a lot of other viruses, or what's called lipophilic. That's short for lipid philic, wanting. It kind of attaches to that. And soap bubbles have lipid on it. So that lipid kind of combines with the virus and just gets them off a lot easier, just wipes right off like with that water. So I think that's why soap and water should work fine. But again, there are obviously some times when you're out in public, let's say, you don't have access to soap and water. So then, yeah, having disinfectant wipes or having some hand sanitizer is helpful. I will say, I think, as I mentioned before, having gloves is one of the least useful things you can have in public, I think, unless you're constantly changing your gloves. Because again, you're going to use a gloves, touch it, something dirty, and then do you change it? No, you don't change it right away most times because you didn't even know you touched something dirty. And then you're going to do what? You're going to go into your car and then maybe touch the steering wheel, or maybe let's say you take them off. But even before you got to the car, you say you got your gloves dirty on the grocery, cart. Then you go and then you lift up your box, right, of Costco stuff and put it in your trunk, and now your box is dirty. Do you see what I'm saying? Like, so that's why gloves are not very useful. It's probably just better to wipe stuff down and wash your hands and use hand sanitizer, because once you put gloves on, you're technically only supposed to touch one thing. When I put on gloves in the hospital, I touch one thing. The patient/patient's room. I open the patient's, I examine the patient, touch them, and after that, I immediately take my gloves off and throw it away. We go through a lot of gloves. I mean, I go through I probably go through at least 50 gloves a day, 50 pairs of gloves a day, minimum, as I go in and out of the hospital and in and out and seeing patients, So, basically what I'm saying is that if you're really going to use gloves, you're going to be, and using it the right way, you're going to burn through a box of gloves a day almost, I think the glove boxes are 50 or maybe they're 100, I think. Anyway, my point is that there are safe ways to do this, and there are safe ways to stay clean. A lot of this is just logical. So, everyone seems to be doing a pretty good job, and especially Hawaii, our numbers are really, really down. But mark that on the calendar. I know everyone's going to say, oh, you didn't say this before, or we didn't know. Everyone wants to go to the parks. For example, in Miami, there's a beach in Miami, a certain park beach. They had to shut it down again because they gave out 8,000 warnings because no one would wear their mask. So again, hashtag, this is why we can't have nice things, because no one follows the rules. Even when they say they will, they don't. They don't follow the rules, No one follows these rules. And even when they do, sometimes after a while, they slip up and people just get lazy. And this is going to be a one-year fight. We're not truly going to be done with this until we get that vaccine. And if you listen to some people, that vaccine might not come until April or May 2021, next year. So we got a long battle. I will have all these. I think we passed our worst peak. So this is hashtag some good news, because I've, again, been accused of always having bad news. So some good news, I think we hit our worst peak if we can keep up these practices. Some people think the flu will be much worse that season in October, November, December. I don't think so. I think it has the potential, but I also think it's based on other data before from other years when no one was wearing masks in America. No one was washing their hands and using hand sanitizer. We are now. So I think our worst peak may be behind us, but we're going to have to deal with second wave, third wave, fourth wave, fifth wave until we get it done. And we just got to be ready for that, I mean, what it boils down to, and I think, I'm going to start ending soon because I try to keep these under an hour now, is that, when the protesters get out there and say we should open up society right now, I'm sick of being inside. No one's really getting that sick. No one's dying that badly. It's kind of like the flu, and the ventilators aren't overused. The hospitals aren't overwhelmed. So we can get back. I say that's fine. I've never said that we should do this forever. I am okay with opening society and certain parts of industry slowly in the right way. But I mean, essentially the people who are saying, I don't care about this, or we don't need to care about this, they're saying that, certain lives and certain people don't, I guess, deserve the best chance compared to the rest of society. So what I'm saying is this is a moral dilemma that everyone has to decide for themselves. Because even when they open up society, you as a citizen are going to have to think, what role do I want to play? Do I want to go out and run around in the beach and join all those parties with people without masks just because I really miss that? Or maybe should I still try to stay away from that stuff? If I go by a bar that looks like it's awesome, or a restaurant, but they're not practicing the social distancing things, and they don't have those open, really separated tables, and they're maybe breaking some rules, should I go in there? I mean, logically, this is adulting stuff, COVID adulting stuff. You have to figure out, is that worth it? Welcome to Nina the Explorer coming in from Instagram Live. So, everyone everyone matters. Yeah, it's not just Black Lives Matter. This is not. I'm not trying to say all lives matter, but uh, everyone deserves a chance to fight this. So even when they open up society slowly, which they are doing, and let's get really good. Let's say they open up almost everything besides sporting events and bars and movie theaters and stuff, and maybe beaches. But say everything's open, you are going to have to decide, because it's going to be too many people out there for the cops to write all these tickets, and honestly, it's not productive. You are going to decide when those numbers look bad, what you're comfortable with, when you should go out with a mask, which I'm going to tell you right now, I will go out with a mask until either I know I have the antibody, which might be as soon as tomorrow night, and that it has immunity, or until there's a vaccine. So I plan on wearing a mask outside in all public arenas for the next year. And I know a lot of people don't want to do that, and that sucks. I mean, Asian people are used to it, but a lot of people don't want to do that. So personally, I think we have to be prepared for that. We can open up society, and we have to decide for ourselves, what is the currency, what's the value of that old person's life that is so afraid that they haven't left their house for a month and may not leave their house for a year. Literally, they will follow the rules, and you get to enjoy everything, but at the very least you can do is wear that mask and wash your hands while you go back out to that restaurant, while you go back out to even have, dinner, or at least your book clubs or whatever, and stuff that you want to do that's sociable, or your socially distanced, yoga classes and other things that are, you do, at the very least, for all those people, and not just the people that can't stay home, that are first responders like me and everyone else, but the ones who are still staying home and will not, like my mom and my dad, like the people who just went through chemo, who will not be able to go out. They will never take the chance to go out, because they know if they do get sick, that's it. I talked to one girl recently, a friend of mine, and she had 3 relatives, not 1, not 2, 3 relatives, an aunt and 2 uncles that died from COVID-19. Think about that for a second, okay? Now, they were 70 and they did have medical problems, she admits, so they could have died of something else, but they didn't have to die. They died from COVID-19. And I know a lot of people, and there's a lot of that conspiracy that, oh, well, did they really die of COVID-19, or did the doctor just put that on the death certificate so the hospitals can get paid more, yada, yada, billing, all this stuff. People don't understand, it's not just that people die of one thing and you only die of a heart attack, or you only die of stroke, or you only die of kidney failure, or you only die of pneumonia. When you die of a combination of things, and your body fails. Slowly your lungs don't work, and then your kidney starts to shut down, and then maybe your liver, they call it hepatorenal failure. Then you go into complete ARDS, or acute respiratory distress syndrome. And maybe you have a heart attack on top of that because of the strain of the ventilator, other things. So when you die, you don't just die from one thing. You die from a multitude of things sometimes. That's why it's a painful thing. And I feel really bad for my friend, because her older 70-plus-year-old, but that's not a lot older than some of us. I'm 43, I know people who are easy in their mid-50s and are very at risk. Even if they have those comorbidities, even if they had high blood pressure or a little overweight, or have diabetes or something, they didn't have to die. Her uncles and aunt did not have to die. We have to be better for the people who don't get that choice. And I don't mean that for all the doctors and the EMTs and everyone else and the nurses. People are really nice to me. I get cheers when I come home from work, and I get free McDonald's, and I get discounts. Welcome to Christina coming in. Wow, Christina, all the way from, I think, Czech Republic, who's doing excellent, by the way. Again, Czech Republic and some other countries like Taiwan and South Korea are doing amazing with COVID-19. We have to be good. And for example, in the Czech Republic and other places, they have learned to wear masks, not because they're afraid of getting sick, also to protect ourselves, but it's a sign that I'm doing this for you. It's like, I'm doing this for you, like when you get in a car and you're driving around, this is a good example. Would you put on your own seatbelt if you're driving your kids and everyone else and make sure they put on their seatbelt? You would, right? Most normal people would. If you don't, I think you have a problem, but that may be your right. But as a driver, when I have people in my car, why would I want them to put on their seatbelt if I'm not willing to put on my own? I don't, that's a very great example. I think you should use that example about why everyone should still wear masks, even after you got sick and got antibodies, even after more and more people are going out, even after they open up society, you still wear masks and you still wash your hands and you don't slip up, So anyway, we're going on an hour. I am trying to cut this. My earlier ones were like more than almost 90 minutes or more. So I'm going to try to end this right here. Yeah, Rainbow says, so proud of our homeland, Taiwan. Yeah, Rainbow, we did not have a lot of help from China and the World Health Organization. I don't want to get political. People have known I've talked about this, but Taiwan, South Korea, Hawaii, I'm proud to be Hawaiian because we're taking it seriously and we are hurting very hard from it. 37% unemployment, but we will get through this. And it's not just we're all in it together. I mean, we need, it doesn't too much. I think, let's think about everyone else, really. That's what I would rather say. Let's protect everyone else, That's a more direct way. I want to be direct and more forceful. Let's protect everyone who cannot do it for themselves, okay? So that's it. I'll leave it at that. By the time I'll have a normal podcast on Thursday at about 1 p.m. Hawaii Standard Time, 1 p.m., okay? Or actually, you know what? I'll do it 4 p.m. I'll do it 4 p.m. because then I'll be better time for East Coast people and for the Pacific West Coast people. It won't be so good for Christina and people in Europe, but yeah, I'll do it then. And by that time, I'll have my antibody test results, and you'll know. I had a really bad in February, an awful one. For 1 month, I took 3 antibiotics. I had trouble breathing. I had hacking dry coughs for weeks. And I just traveled, internationally to Australia and New Zealand. So it's, I could have been exposed easily. But I'll give you that news, and you'll hear it on Facebook too. So again, that's it. Rainbow, Atlanta, everyone who's checked in, thank you for checking in. And please stay safe. Virtual hug all your loved ones, or then actually hug them if you can stay clean and trust them. Wash your hands. And again, you can add me on Instagram at @thetraveling_MD, or add me on Facebook or YouTube, The Traveling Doctor, or on Twitter at The Traveling Doctor. Okay, everyone, this is The Traveling Doctor, Dr. Albert Lin signing off. Aloha, stay safe, and